QB chasing.
G'day, listeners, and welcome back to another very special episode of the Matter Mentality podcast, where we talk all things training, nutrition, and psychology to optimize your performance. Today is a very performance unique conversation, I think, that needs to be had and will be had in this very recording around all things men's health, testosterone, TRT. I'm joined by Alphagenix lead doctor. Yeah, that's like that. You can make sure I get that right. Lead doctor, Dr. Max Draper. How are we doing, brother, all the way from the UK?
Very well, thank you, Ben. Thank you for having me on. Pleasure to be here.
Now, you've just returned. We just had a bit of a chat off camera. You've just returned from Big Ali's Silverback Summit. How did you find that? How'd that go in the world of men's TRT and health?
It's awesome. Yeah, it's really good fun. It's particularly good fun for me because being from the UK, there's not many physicians who kind of are hyper interested in this area, thinking about men's health and but also sort of linking, TRT hormonal stuff to actually the lifestyle stuff.
Yeah.
Exercise, all of that thing. So meeting with coaches, I meet a lot of my heroes there as well, people who I've looked up to online for a while. So for me, it's a good experience socially, but also obviously there's a lot of knowledge you can gain over there as well. So it's really good fun, really good fun.
How long did you end up staying over there for? Because obviously, I think the flight's a little bit quicker from you guys from the Atlantic side to America than it is from us to get to America.
Yeah, and we went out on the Wednesday, flew back on the Sunday, so it's like 5 days. It is a long journey to Arizona because it's not a direct flight. So if we added up the waiting in London Heathrow to fly back up to the northeast of England, I think it was like 18 hours back,
Oh, yeah.
and about it's a good day. It's a good
Yeah.
day of traveling. Yeah, but you can't complain. I mean, the company pays for me to go as well, so
Yeah.
I can't complain too much.
Yeah, it's definitely something when your career meets passion meets education is able to facilitate travel and world experiences and meeting up with different people. Like we do the same thing. Our company pays for the presentations we've been able to do with Coach Catalyst over in America, in Reston, in Washington D.C. We've traveled to I think 10 states now in America, so it's great. It's an absolute haul of a flight. I think in total we do 17 hours on the first leg, and then depending on where we connect over to, it could be anywhere from 25 to 30 hours of total travel between by the time we get to where we're going.
Yeah.
So it's a long haul, but it's like the experience is still great. We're flying to present information and talk to people and engage with colleagues that are on the other side of the world. So can't really complain too much, even though the flight gets very narrow and stiff and tight very quickly.
Yeah, yeah. Well, it's one of those things as well where you can't beat that face-to-face meeting people in person. And so, although you and I live kind of like America's obviously quite big on men's health and health optimization. So, sadly for us, we do have to travel. We do
Yeah,
have to travel over there occasionally. Well,
yeah.
it's good fun being there, but the journey's a bit takes it out of you.
Yeah, how do you find at the moment in it's kind of gets the conversation going, but how do you find the difference between the UK? Like I kind of know obviously being in Australia what it's like here, but how do you find that difference between America and the UK in regards to men's health, men's wellness, the perception of TRT? Like, is there a stark difference? Is it as drastic as what we find it is over here versus America?
Yeah, I think from what I gather, the UK is probably more similar to you guys, really, in
Yeah,
Australia. There are sort of small sections like Alphagenix, and there are other TRT clinics as such. But in general,
yeah,
the view is much more like Australian view of TRT.
yeah,
Um, America's America's got really good points to it in the fact that there's a lot of open-minded, really well-researched physicians out there. Obviously,
yeah,
you get the other end of it, which is more of the cookie cutter clinics that are
yeah,
just making a quick buck. And so you kind of have more of a wide spectrum of
yeah,
examples in the States, I think. In the UK, it's kind of like You have the NHS, which is obviously our National Health Service. They have quite a, well, to put it in my opinion, quite a limited view of when TRT can come into
Yep.
play. And then in the UK, you obviously have a sort of fairly, obviously a much smaller private sector than the
Yeah.
US. And that's where, I would say true analysis of potential benefits of TRT comes into fruition a little bit more as such. Yeah. So it's
Yeah.
quite similar to Australia, I would say.
Yeah, I think I've noticed, looking at America, especially the private sector, with the drive for privatization in the health sector. Yes, obviously, there's a lot more on the expense side for the individual, the end user, the patient or the client, if you will. But with that comes that increased, though it still follows a general distribution. So you still see, like, the extremes for America's private health sector. You're looking 2, 3 standard deviations outside the norm. They're very high professional. The quality of service is quite good. They take that information on board. Well, obviously, with that comes a bit more towards they have that just as equally the opposite end, the charlatans, the rip-offs, the cookie cutters, the scam artists. But the bell curve is bigger, in my opinion. Like the bell curve, what falls under that is quite big from in America. Obviously, 360 million people. So I kind of find that it does increase that availability of more of the good, but with that increase of the bell curve, obviously comes that increase not so good. Whereas, like you said, with us in both UK and Australia, it's very much the NHS, public sector, poor perception of TRT and men's health, very limited private sector, perception and availability.
100%. I mean, I think in America you kind of probably have to do your own research so that you don't fall into the charlatans, the kind of the one size fits all treatment where everybody gets 200 milligrams a week with two halves of an anastrozole a week, or something like that. Um, so you have to do your research about finding a good option because you've got a
Yep.
plethora of choices quite often. But then in the UK and Australia, I think probably what is more key is doing your research to find someone who does it well,
Yeah.
um, which is not as obvious and just out there as in America.
Yeah.
So there's a TR, I have loads of friends obviously in America, and there's a TRT clinic on every corner. That
Yeah.
probably is not always a good TRT clinic, but
Yeah.
it's kind of so your idea is you've got to sieve through what you've got available to you. In our countries, it's more you've actually got to find what's
Yeah.
out there. Yeah.
Yeah, it's essentially like America is the Netflix of TRT. They've got just a variety of options and streaming like straight to your door. Australia and England is more of like the old rental DVD stores. Like what's available is all that's there, and that's all you get. You got to pick and choose
Yeah.
of what's left over, and that's pretty much all that's available. I kind of find it sits in that sort of model, which is yeah, not great. But it leads to a good conversation because to me, especially in UK, Australia, there we do have the NHS and obviously our Medicare system. I believe does England use Medicare? Is that the title of like the health system?
It's just the National Health Service, basically. Yeah, we don't have any terminology like that as such here. Yeah.
So with ours, it's basically like to go into, and I've found this as a bodybuilder. My clients have found it. I've worked with bodybuilders, even just my performance athletes, my health screen athletes. I look at more of a how do I help you work from an optimization level? How do we get to a level of not perfection, but physically a better position? The health service currently runs more on like a deficit model or a depreciation model. Come to us when you're broken, come to us when something's wrong. And the amount that you have to kind of beg, push, plead to kind of get that reciprocity, that feedback with your practitioner is quite limiting. We have to ask a lot of specific questions. Like we have to go through a lot of things to say, to try and get even a baseline test level, as in like sex hormone profile tests. And I'm sitting there being like, hey, can I please get this full plethora spectrum of blood panel counts, sex hormones, T3, T4, free T3? I want to see this whole list, this tirade of things, IGF, growth hormone, cortisol levels. Can I get this full spectrum? And we've got to sit there and justify to Medicare or the NHS why that should be funded. And it limits our abilities to understand health from the complete holistic window, in my opinion, when we're only going to the doctor when things are wrong. It doesn't encourage us, even as men, especially as we get older and these health side effects kick in, it doesn't really encourage us to go be proactive. It's more so just, come visit when something's off, or if you feel like, your junk isn't working, or you can't get it up, or, you're shooting blanks. Well, there's other reasons why I want to be healthier, or get my blood work done, or get my panels done, or look at my sex hormones, than just whether or not I'm, clinically depressed or my dick isn't working. So to me, that's kind of the limitation that we have in Australia that I believe would probably be very similar in England. Just even opening that conversation of TRT, blood work, testosterone, and just overall health.
100%. Yeah, I mean, you describe it really as sick care, basically. It's if you're ill, particularly if you're, very unwell, for example, if you're in a car crash or something like that, then the National Health Service is excellent. And I think there's a large degree of almost mental security knowing that it's covered as
Yeah.
well. Having said that, the reverse, the sort of negative aspect of that is if we're talking about, are we well now and staying well, and
Yes.
how do we track, and tracking those metrics and things like that, that's just not really part of the package as such. So many men see me who have requested just as simple as a total testosterone level, and they've literally been denied. And,
Yeah.
even if they've got symptoms, it baffles me because it is kind of like, it is a pathological condition if you have low
Mhm.
testosterone. The data is quite clear on that. But yeah, so that kind of concept of health optimization, health awareness, health tracking is not really part of the remit of a national health service. And I think sometimes in the UK, I don't know what it's like in Australia, is people find it difficult to accept and make that distinction when they're seeking that care out. It's kind of like, well, you're just really not going to get that service
Yeah.
from them. Like, we just have to accept that it's there
Yep.
for if things have gone wrong,
Yeah.
then they can help. But if they're kind of like, if you're avoiding them going wrong, largely they're not, that's not what they're there to do. And I think people sometimes get frustrated as well with like GPs not knowing much about testosterone and things like
Yep.
that. And having come from the world of GP, it's kind of like, well, we don't get taught about it. We, if anything, we get a lot of myths thrown at us. A lot of rhetoric, and so they're just, again, you just have to know the limitations of what's on offer, really.
And it's an even a better question there because, like you said, it's such a limitation, and it's not so much the doctor's fault, right? You go to a GP, it is a general practitioner. You go in there for a general oversight. Understandably, it's hard as the doctor. I can only imagine when you do have someone come like, look, I want to be checking this. Like, I'm a big believer from the age of 20, we should be looking at taking blood work and seeing how we're tracking, how are we healthy, how are we doing things. 20 to 30 is so much toxins, drugs, alcohol, poor food choices that go into our body just from that lifestyle of being that age. But it's worth tracking, understanding how we're projecting or how we're trending. So I'm a big believer in having that data. But as a GP, that's it, and especially in like a social care system like Australia, like England, that is less privatized than America. The GP, I believe, has to rationalize why that payment or that service is required to the overall health system. Like, well, if for Medicare, for example, they have to rationalize why that blood work is needed. And obviously, if that person isn't sick, well, then it can't be a justified Medicare expense. The government is going to cover that. But to me, it's understandably frustrating. I can only imagine from the GP side that perhaps when you do want to be proactive and help your client or your patient, and the system isn't kind of set up for that. Did you ever experience that as a GP first before you got into this route where it was like, I want to do X, but can you give me the words that you need to say so that I can tick that box?
Yeah, because it's largely with the NHS is largely a degree of everyone's kind of either consciously or subconsciously aware of the fact that it's resource management and
Yeah.
resource allotment. So if you imagine if someone comes in and they want sort of extensive, almost like you could say preventative or a deep dive into their health, it's kind of like, yeah, but we're kind of aware that we can't order too many investigations because we
Yeah.
kind of feel like we're kind of using resources and there's only a finite amount. And this is kind of, you know, there's just always in the back of your mind, there's that resource management, time management, but also expense management. So yeah, definitely does come up. I think the other thing that is a big thing in the UK is purely and simply, if you see a GP, the chances are is that appointment is 10 minutes.
Yeah.
So if you include the fact that you've gone into the room, you've walked into the room, then, obviously there's some chit chat conversation. You're really talking about 7 minutes to
Yeah.
conduct a history, make a plan.
Yeah.
Like, it's like my initial appointments to assess someone for a, potential TRT, they're an hour.
Yeah.
And sometimes they'll come back for a further conversation just to, finish off any points we might have missed or if they've gone away and thought about any more questions. So you do have that benefit of time in the private sector, which is just
Yeah.
not there in these systems. So 10 minutes, I mean, you can deal with, coughs, colds, minor illnesses in 10 minutes, but actually a deep dive into your
Yeah.
health, assessing where you're at. I mean, it's just not going to be able to be done really.
Yeah, I think even like myself on the end of coaching bodybuilders and athletes like that, when we start looking down, hey, I want to review your blood work before we make any commitments towards, going down the supplementation route, the exogenous hormone route, that's obviously required in the bodybuilding space to get to the size we get to before, before that even happening. There is a full comprehensive assessment. Like, we're talking like I think I get on average 5 vials taken per quarter to make sure that my
Mm.
body's in the position to handle what I need to do. And I expect no less from my team. And then we go through those numbers, we go through that data, like what are we seeing? What are we expecting? Is this normal? That level of comprehension, and I'm not even at the level of a practitioner that is going to that level of depth to be able to prescribe and give TRT at that level and make those interactions. It's it can't be done, like you said, in that short period of time, which does leave the whole of something that is as important as men's health, like to look at the comprehensive, holistic picture that is men's health. It can't be done by a 10-minute GP visit. And I think that's where, as you kind of alluded to there previously, men have to get to the acceptance of is that if you really want to take charge of your health, it can't just be, firstly, it's already hard for men to get to a GP. We already don't go. But to get to that point where you're really trying to optimize your health for longevity, for family, for performance, for sport, you just have to accept that you're not going to get that from a GP. And you'll have to move to a private clinical setting like yourself, like Primazone in Australia, like Marek Health in America. You're going to have to go to those providers that can give that tailored, in-depth information and start to address things on a more specific, like isolated level.
Yeah, 100%. I always say that by the time we finished actually with the patient, me and the chap sat there having a chat online. Usually it's a Zoom call, to be honest, that I do.
Yep.
Um, just actually, by the time you've assessed them psychologically, physically, and sexually, which are kind of the three areas that I look at for obviously testosterone issues, you're talking about that's sort of 25, that's 25, 30 minutes in already. And that's just part of the history
Yep.
because you've got to work out, it's like that, like you're saying about that holistic approach. It's like testosterone issues can cause plenty of symptoms, but
Mhm.
so can lifestyle issues. So
Yep.
can, depression itself, irrespective of your hormone level. So it's kind of like working out, right, well, is this, when you're taking that history, it's kind of like working out is what's driving these symptoms. And that's not a quick few minutes like, how do you feel? Oh, okay,
Yep.
well, it's probably this. It's more in-depth analysis. And like you said, even with the blood work, it's taking your time to go through it. I think what people like as well, from a men's health perspective as well, is when we've got the labs, the blood work, like you said about doing detailed lab work, is you can actually go through it with them and
Yep.
say, look, dude, like this doesn't look great. We need to do something about this. Like, let's say it's take it a HbA1c or something, and you say,
Yep.
look, you're kind of like you're riding the road to diabetes here.
Yep.
Like, giving them that objective data
Yep.
can be quite useful. I find with men, they're much more responsive if they have a number in front of them.
Yes.
And you say, look, dude, unless you start going to the gym, lifting weights, watching that sugar intake, etc., you're gonna end up with diabetes in, X amount of time. So I think that time that you have with people, the detailed lab work, that is, I think my job's incredible now. I love my job because I just
Yeah.
think compared to when I was a GP, it's night and day difference, really.
Yeah. Well, let's go through that. So I'm quite curious how Alphagenix does it in the sense of what is that? Not even that onboarding, because I really respect. I do a very thorough client onboarding process. Like I work with some clients from Primal Zone that are looking more. They don't get approved for TRT. It actually shows they probably need more lifestyle intervention first.
Yeah.
So even at my level, the level of comprehensive lifestyle assessment that I do first before it's like, they come to me usually for an introduction for Primal Zone saying, hey, we're not sure this person actually needs TRT. Blood work doesn't look too bad, but it's their lifestyle that seems like it needs work. I'm going to go in depth with them. It's like, well, how did we get here? Why do you feel like shit? Yet your blood work says you should be okay. That, as you said, sexually, psychologically, physiologically, it all starts to tell a complete picture. What does that process look like for you to get to that position where you're like, yeah, this person actually probably does need TRT, or we're looking at how do we modify these or manipulate these problems first before we look at TRT?
Yeah, I think exactly that. So you're talking about how are you feeling? How long have you been feeling like this? And then it's about working out, well, what other health issues do you have? Let's say they're high, they have high blood pressure, maybe they're pre-diabetic, or maybe they've got a history of X, Y, or Z. So you're just learning their symptoms, learning their past history, and then it is ticking those, going into those boxes of, do you exercise? How's your sleep? How's your
Mhm.
stress levels? I mean, stress is probably one of the biggest issues we see in terms of, you know, people are living sort of this chronic state of sort of semi-stressed all the time, really. You look at diet, nutrition, and then you kind of work out a plan based on not just the labs, but the symptoms as well.
Yeah.
And I always say my job is, at least on that initial consultation or two, is basically working out, is the issue a testosterone problem, number
Mhm.
one? And if it's a testosterone problem, is TRT the answer? Because like you rightly said, I mean, sometimes the answer is that you need to go away, you need to prioritize your sleep, you need to
Mhm.
start eating a better diet, you need to start exercising regularly, you need to shift 10, 20, 30 pounds, and then see if that corrects how you feel. And and by proxy your bloods will probably look better as well, very
Mhm.
likely. And if it's not a testosterone problem, is it thyroid? Is
Yeah.
it something else going on? Because I got told a long time ago, when you're holding a hammer, everything looks like a nail or something
Yeah.
like that, and saying don't over fixate on testosterone because there
Yeah.
are there are actually other health issues.
Yeah.
And I
Yeah.
was like, hold on a minute. Yeah, now I remember. Yeah,
Yeah.
yeah.
Yeah. I think it's a clear, it's a fair but completely understandable analogy for the situation because people will come and I've had the conversation and they're reluctant to work with me because they thought, oh, if I go to this private clinic and say, oh, my dick doesn't work, then they're going to get steroid injections and start getting clinical testosterone. It's like, especially in countries like Australia, it is not that simple. But also, you don't want it to be that simple. You don't want exogenous injections to be the solution because all it becomes is a band aid. If we aren't
Yeah.
getting to the root cause of the problem, then we're just continually having to apply that band aid over and over. Yes, eventually we get to the point where testosterone production slows down. We all know that men go through that. But turning to exogenous testosterone too early, in my opinion, there is much deeper issues going on. If that's required at 25, 30, that you're starting to need TRT this early in life, like to me there are a lot of other issues at play that we need to look at and assess before we know for certain, like, yes, that is a TRT problem. And as you said, hey, what if it's not a TRT problem? Is it lifestyle factors, stress factors? Do you have no purpose in life? Do you have no ambition or drive? Is it an inverted relationship? Do you not have drive because of low testosterone, or is your low testosterone because you sit inside all day, don't chase anything, and you sit in darkness and wallow in self pity? How is this relationship forming, and is it inverse in the other way? All these things start to be brought into the conversation. And this is what it kind of amuses me very heavily in Australia, and I think in Western countries, it's not demonized would be the wrong word. Actually, in some areas, it is demonized to address solely men's health. It's always what aboutism if we look at men's health, or we look at having that conversation just about men's sex hormones. It's like, well, what about this gender goes through this, or this group goes through this? Like, okay, but those two things we can have this conversation. They're separate issues. There's such complexity to the male existence. How do we address it so that we're healthy? Suicide rates are through the roof. Mental health issues are through the roof. Physical health is where 8 to 10 years we're 8 to 10 years faster, more likely to die. I mean, 10 years younger than the average female. All these things start coming into play. At a certain point, a lot of that becomes health issues, sex hormone issues, lifestyle issues that lead to that outcome. So to me, it's like, it paints such a complexity of a system that we need to understand. And there's people that, in my opinion, don't seem to want to have that understanding.
Yeah, I think you touched upon something really important there as well about the is it the low testosterone causing the lack of motivation, etc., or is low testosterone the result
Mm-hmm.
of not looking after yourself, not doing the things that we know we should do? Um, that's kind of like the chicken and egg that I
Yeah,
think is so key to analysis of men's health, which is look, do you feel like crap because you're treating your body like crap? And like you said, you don't have a purpose, you don't have that thing to get up for every day, whether that's be family, kids, work, whatever it is, self-development even. But it's kind of like, is it innately that it's a result of your hormones, or is it actually that your hormones reflect your
yeah,
day-to-day activity? And that is kind of like, that's really difficult to act. That's actually quite a complicated
yeah.
question because
It's a loaded question.
low testosterone actually leads to things which
Yeah,
causes lower testosterone. So if you're gaining fat, you're becoming more insulin resistant,
yeah,
you're getting less motivated, less energy, poor sleep, lower confidence. Like that's actually resulting from having crap hormones,
yeah,
or has all of that stuff led to your crap hormones? So
yeah,
it's kind of like
yeah,
that is a really that's basically large part of my job. And the other question really is, and this is kind of even more nuance to each individual, and you'll appreciate this doing what you do with Primal, is um, will TRT help you on the road
yeah.
to, getting your lifestyle all fixed up? Or do you need to do the lifestyle, etc., before
Yes.
reassessing if TRT is necessary? And that is kind of like, that's really like delving deep into working out, look, this dude feels like crap. Yes, we can say you need to do X, Y, and Z, but it might be that TRT gets him there.
Yeah.
Or it might be that, he's much better off just knuckling down, getting lifestyle purpose, everything like that sorted, and then reassessing. Because, like you said, often if it's all these lifestyle factors that are causing the low T, some guys can just correct it with
Yeah.
knowing objectively, look, your blood work looks bad, but if you sort this, sort your stuff out, you can really correct it all. That's a really, yeah, I thought we'd delve into that a little bit there because that is really part of the hard part of the job is working out which avenue to go down. But you
Yeah.
said as well, what's key is that the best result is that you have good, natural, healthy levels of
Yes.
testosterone, and you don't need TRT because TRT is a bloody, it's a ball ache. You're injecting.
Yeah.
I'm injecting
Yeah.
testosterone for the rest of my life.
Yeah.
Um, it complicates fertility.
Yep.
Traveling with needles, things, everything like
Yeah.
this, or your cream. Life is much easier if you can get your own healthy production
Yeah.
back or keep it as long as you can. That just makes life a lot simpler, really.
Yeah. I think even just on the topic of the chicken and the egg, looking at what comes first or what might be useful. You probably appreciate as a GP, I've had this conversation several times now. There's a big movement currently in this psychological or psychopharmacological space where things like SSRIs and antidepressants, antipsychotics are being looked at as like oh, exercise is a better choice than than medication to solve X problem. It has a greater significance or a larger significance was found in the effect size, yada yada. But one of the things that I've found in quite the diverse population I've worked with is sometimes the medication is needed to get the person moving. It's the tool for the job instead of, like you said, looking purely for the hammer. This is male and female, but specifically for men, there's this big ego macho system at the moment where it's like, oh, you shouldn't need to take drugs. You're a pussy if you have depression or this. You just get up and do it. Like sometimes the effects of psychopharmacology are going to be the thing that allows you to get up and go after it. Other times we're going to look at it and say, well, if we get up and go after it, will we need the psychopharmacological active ingredient? Probably not. So, to me, it's like having that conversation. There's this weird movement in fitness, as always, in coaching, where it's a dichotomy, like sort of belief. Medication's killing you, it's horrible. Get up and get after it. It's like, yeah, but just sometimes it might be that you're telling that person to get up and get after it. That drug might actually help them do that to then no longer need the drug. So, just shifting that understanding of psychology, pharmacology, whether it be injectable TRT, whether it be antidepressants, SSRIs. Again, it's not always choosing the drug just for drug's sake, but just having the conversation that sometimes that might be the thing that's needed to get us going, and that's okay. Other times it might be actually you do need to pull your finger out and just get going, and then we can reassess if that's necessary. This is something that an experience that I've kind of had in that realm, but it leads to a very good question as a practitioner in that space. What are the trends, or what's some significant trends you're seeing in the men that are coming to you in the health space? Like, are we seeing lower testosterone levels on average, or decreased thyroid functionality, men just being largely overweight, or faster blood glucose levels? Are you starting to identify general health trends that we as coaches could go, how do we look at fixing that before that even gets to the point of needing the practitioner?
Yeah, yeah, 100%. I mean, I think the trending is exactly like you described it. We're seeing more low testosterone in younger guys. It's really, not uncommon for me to see guys in their 20s who are suffering from symptoms of low T and have testosterone levels of someone who kind of, is in their 70s, 80s, really. And it's not that they've got a huge, testicular trauma. It's not that they've had some brain injury in the past that's caused an overt deficiency. It's just environmental, touched with a little bit of lifestyle factors as well, that's causing these levels to just really probably never get that great. They're probably never seeing those teenage, early 20
Yeah,
peaks in testosterone that they should do. I think Dave Lee, that as well, he talks about the environmental toxins involvement in this, and I think that is sadly something that is almost unavoidable to an
yeah,
extent. But I think that's definitely having a knock-on effect. Yeah, large degree of thyroid dysfunction. I've spoken to Dave Lee about this as well, and he suspects it's a lack of sunshine. But there is definitely the environmental toxins in that as well. We've spoke about that before. And yeah, insulin resistance. I mean, the whole thing comes together. Your hormones aren't great. You're gonna be very prone to insulin resistance, particularly with a sedentary lifestyle. So yeah, the trends is definitely lower hormone output, let's say, in terms of the sex and thyroid hormones, higher rates of insulin resistance, and I think it's obviously a combination of lifestyle, environmental. But what
yeah,
is key is that I think you said before we came on as well, is that just get your lab work done at an earlier age so that you can
yeah,
follow these things and tackle them before it gets worse, before your dick doesn't work anymore,
yeah,
before
yeah,
you develop before you develop anxiety and depression, before before you're carrying an extra 50 pounds of fat. Like, that is what's so key. It's being proactive and preemptive. And then you don't have to, hopefully, go to see me for the TRT when you're really far down the line. It's
yeah.
about catching things early and correcting course.
Yeah, I think it's again, it's something that men, it's such a unique system that we face. The environment doesn't, in my opinion, foster the drive for men to go get health checked, to go get health assessed, and to be proactive with health. There's a lot of, it's getting better, but there's a lot of conversation still around, like, you'll see men mocked for things not working or for being unhealthy or for being XYZ. And it doesn't lead them to want to figure it out. It leads them to kind of shine away further. So yeah, even culturally, we're seeing a kind of a resistance, or at least a friction point for men getting to get those assessments done at whatever age, whatever level it might be. Obviously, the sooner the better, and before proactive, before reactive. But it's such a there's a really good psychological model that I believe it's not Erickson. Bronfenbrenner looks at, which is basically like the psychosocial ecological model, theoretical model about how from the individual right up to the national social level, all these intricate interactions and systems and relationships impact the individual, and then how the individual impacts those things at large as well. And I think it displays a really important concept as to how men's health is actually viewed or can be impacted. Just getting national recognition that men's health is a crisis that does exist. Suicide hotlines need to be more prone to men's health. They need to be more aware of the struggles men face. Sex hormone profiles are dropping. What does it look like in a male's relationships? Like, are they exploring relationships with females? Do they have close relationships with male friends? Do they have team cohesion? Do they have these, as Dave kind of puts it, those environmental factors that impact the male experience? Because as we know, like as a system, as a feedback loop, that will impact men's health, men's testosterone levels, men's sex hormone levels, and then inversely, how they feel because of that. So to me, it's whilst it's coming a long way, there's still a long way to go in having that social level of understanding, besides, obviously being coaches and practitioners that we get it. I think in the general population, still missing that key comprehension that men's health is a unique field, different to gen pop health or females' health. It needs that proper attention and perception.
Yeah, I think and talking about things like suicide hotlines and things like that it's just I'll tell you a depressing thing I saw when I was doing some online courses for testosterone deficiency. This is a few years ago now. There is the British Society of Sexual Medicine. It's like they develop courses for testosterone deficiency in the UK, etc., etc. And they had this course, and they was going through the slides, and of the GPs, obviously, majority of GPs are female nowadays. So there's a slight, I think it's like 60-40. It's not a dramatic, it's not unequal massively, but of those female GPs, there's a large percentage of them would say that they were interested in female health or women's health. Yeah. Of the male GPs, I think the statistic was like 1% or below reported that they had an interest in men's health.
Yeah.
So this is kind of like a real issue that it's just not really a topic that's on many general practitioners' mind. And in our countries, the GP is kind of like the first line.
Yeah.
So if you're going to see a GP, the majority of which don't really have an interest in terms of in men's health to any great depth, then that is a sort of blockade very early on on the health experience for most men, because like we were saying before, most people will approach the NHS, that system first at least. And if there's a lack of knowledge of this field, then you're really coming up against an earlier barrier.
Yeah, I think it also pairs well, like you said previously, with not even just the awareness of knowledge on men's health, the awareness or the lack of awareness of knowledge that the average GP has on things like physical activity, physiology, and nutrition. Those, before you know to send someone to a private clinic, do you even know that those factors can impact TRT, can impact your sex hormone profiles, can impact, how do we make those suggestions and strategies before you just say, we're going to take a HCG and try and drive up your sex profiles again, or we're going to, go straight to injectables. Do you even know the way these systems have positive or negative feedback loops? That in and of itself is going to be indicative of how good of a result that client gets, because let's say the client does get TRT. As you and me both know, TRT in the presence of poor lifestyle, nutrition, activities, and physical health still does F all. It will do
Yeah.
something, but the margins of effect that we can get out of it if we improve those things with it is significantly greater. And
Yeah.
unfortunately, if we're just going again, band-aid effects, yep, we are going to give you TRT. Here it is with no other interventions. It's still going to be not minute, but it's going to be a drastically less effect size result than if we simply had the better understanding of lifestyle, nutrition, training, or physiology, the systemization of all the interlinking of it, and then obviously the psychology of it all as well. Having that understanding of how it can impact the individual male. The general GP doesn't have that, but it is the first line of defense, or the first line, I guess, the trenches really, that men will go see. And unfortunately, if that isn't well versed or have an interest in even being versed, because we all do extracurricular studies as we should for personal development and career development, professional development. If you're not, if you're you're going to do all of your 100 credit points per year that you have to uphold is towards women's health or cancer this or something else, but before you even know that the male has cancer, he's got to come to you to talk about his sex life or his personal life or his nutrition life, and you have no idea, chances are you're probably not even going to get him to the point of having greater health concerns or wanting to look more at his health lifestyle. Like, it's such an intricate system of interaction, rapport building, relationship building. And unfortunately, like you said, there's just a deep lack of interest for something that is so complex and deep and intricate. It's just like, oh, men will be healthy, they'll take care of it. It's like, will they? The evidence
Yeah.
doesn't show that they will.
Well, it'd be interesting. I think that what's key as well is that, like you rightly pointed out, it's not just the fact that they're kind of not aware of necessarily, and it sounds like I'm GP bashing, but my wife's a GP, so I'll just say that I'm not. I don't.
We're not.
GPs are all. Yeah, yeah. We're not bashing. My wife actually knows a hell of a lot about testosterone because she sat through me talking about it for the last 4 years. But if you went to a GP and said, right, what is the kind of key points about nutrition that men should know? What are the key activities that men should do for exercise in terms of for now and for the future?
Yep.
Um, there's not a lot of teaching that goes into that when we're going through training. I've basically learnt that through, personal interest because I enjoy,
Yep.
weight training. I enjoy going for jogs. I enjoy, fortunately, I quite like a fairly high protein diet, etc.
Mhm.
And the nutritional information, I mean, most of what you'll get told will probably be 20, 30 years out of date. It'll be
Yep.
talking about saturated fats and
Yeah.
it'll be talking about, swapping out for, low fat options, all these sorts of things, which, really we know probably isn't ideal. And so that's a big issue as well. It's not just the fact that they don't realize the link with all of these aspects and your hormone health. It's the fact that maybe the baseline knowledge of nutrition, exercise, sleep, etc., it might not actually be there.
Yeah.
So that's a big issue as well.
Yeah, no, I completely agree. I think it's something I've definitely picked up on is, I'm a very holistic approach coach, I would believe, in comparison to a lot of people. My studies in clinical psychology, my undergrad degree is chasing that. These lead to more, I think, complete questions like what is the intricate relationship between psychological stress, physiological stress, and the sex production? How does the HPG, how does the HPA interact? What is that system like? How does stress impact the immune system? All these things start to connect. We know the psychosomatic relationship is so complex and deep, but the GP average, that can't even the average man doesn't know that. And they don't know who to go to find that out a lot of the time, which is why you get people start to, put out content online that people might deem as dangerous, but no one's putting it out there. No one's having that conversation, which leads to a very good question: is how do you find at the TRT clinical level the current cultural perception of masculinity and testosterone? Are guys coming in scared to talk about it? Are they coming in as like, I want to feel more masculine, more confident, more goal orientated? I noticed that I'm not. Is that because of my TRT? I know personally that had the role that the prefrontal cortex plays in goal orientation and testosterone drives a lot of that. Dopamine, feeling good, reinforcing that cycle to make sure that you are positively motivated. But does the average guy come in looking for that? Are they coming in and saying, look, I just feel like shit? Are they coming in saying like, I don't feel like I have a purpose in life. I don't feel like, I just don't feel like there's a, I don't know how to word it. What's their perception they're coming into with masculinity and testosterone?
Yeah, I think they don't. A lot of guys, particularly the younger ones, will word it in a way that doesn't kind of define, like, say, use the word masculinity. But I think what you said there is that often it'll be kind of phrases like, and they won't even say it as blandly as this, but I don't feel like a man, as
Yeah,
in sort of like that lack of drive, lack of motivation, real kind of intolerance of stress is a big thing with low
yeah,
T.
yeah,
Everything's kind of more overwhelming than it should be. Um, and if you kind of, yeah, if you root it down to the heart of it, I think it is that kind of feeling of I just don't feel like I have that masculine energy really, or that masculine spirit within.
yeah,
And exactly like you said, it's because that testosterone is such a foundation for so
mhm,
many aspects of what we would call sort of masculine traits. But yeah, I think particularly for the younger guys, because it's probably more impactful on their psychological state and progression if it happens younger. Some of the older guys, you kind of think that their psychology is already kind of set in to some degree and
yeah,
they've had good levels before. And then when they have, start having low T symptoms, they kind of think this is something that's weird. This is something that's
yeah,
wrong because I know what my mind was working like before. And
yeah,
now
yeah,
this is a sudden shift. For the young guys, I think it's even more destructive because they never get those decent levels. They never get that peak in drive, motivation, perhaps even confidence sort of thing. So that's a really, yeah, it's an interesting question. There's definitely an element of they're describing some sort of lack of feeling that masculine sort of, I suppose, energy. Yeah.
And where do you think that goes? And this is obviously become again going to be a very low, probably worth even preambling. We should have done this earlier in the conversation. Is that all these questions are so loaded? They're such heavy questions, complex philosophical questions. Because
Yeah.
we're not going to solve these issues in this chat, but I think it's important to have these chats. Because people aren't. We've already established that people aren't having those conversations. And it leads to a lack of understanding and awareness that even the men going through it don't know that we don't know what we don't know. We don't know the answers to questions we don't know to ask. We don't know the questions to ask if we don't even know the questions exist. And so it kind of makes it our job, to have these kind of discussions, discourse, conversations. And it leads you know, to me, a good question, or at least a deep question of what do you think that longer term impact is on this generation of men that will have starting lower levels of testosterone? For me, I'm not sure about yourself with your sporting background and like that, but I was in a sport from the age of like 4 or 5 years old. My brothers were all older than me and played sports, so I was around their sporting life. And then I think I started sport at 5 in competitive rugby league, playing touch, playing AFL, always at school playing sport, and I was just driven to compete. But that led to other areas of my life where I was just driven to do. And the lack of that adolescent puberty range, if you will, for lack of better terms, getting that spike in testosterone, getting that that first burst of experience of I've hit puberty, I'm becoming a man, having that rite of passage. If we're
Hmm.
not seeing those levels reach where they could because of these multifactorial lifestyle factors, social factors, stress factors, emotion factors, what are we going to see as the long-term consequence of that we should probably be aware of and at least start to coach against, encourage, train for, or be aware of in the future?
I think, yeah, it's a really good question. I mean, my opinion would be that we're probably going to see a fairly almost fork in the what's the word sort of deviation either way on a road where you'll get some young guys who are aware of this stuff because of social media, because of
Yeah,
online content, YouTube videos, and they will go down the route of tackling lifestyle, being involved in sports, being driven, etc., etc. And they will go and they will get this peak in testosterone. They'll go down a very different route in life. And then you'll get the other ones who aren't so aware of what, they need to avoid, what they need to do. And they will never get that sort of degree of hormonal change. They'll never get that sort of degree of development psychologically and physically. And so you might well end up with two avatars of very different men, and I don't know if that's kind of sounds logical, but and there'll be gradients in between, obviously, but you may well even get more of a variation in the outcomes of young boys becoming young men simply because there'll be people who either naturally or through gaining information know what they should be doing, what they should be avoiding, particularly environmentally. And then you'll get people who just had no idea and they end up with testosterone levels of a 60-year-old when they hit 20. So there could be a big shift there. I think glow or sort of more widely speaking, it's going to be, yeah, it's not a great outlook if you imagine that more men will have low testosterone at a younger age, and more and more men will never get great testosterone levels. So it's kind of a
Mhm.
bit of both. More will be pathologically low, but also many will never get nice high points. I don't know how that looks going forward. Sperm counts is also something that no one really seems to be concerned by, even though they're plummeting through the data. It's quite disturbing on sperm counts, but yeah, it's a weird future to think about. Yeah, certainly is.
Yeah, and it is a worrying, to me, question worth having. Because one of the other things that I think people don't understand is when we look at physiology, looking at whether it be biochemistry, sex hormones, things like that, endocrine system, or whether it be just looking at physical development, physical maturity. That's kind of the lens we take with things like sex hormones, like testosterone. It's always like it'll make you big and strong, and you build muscles, and you'll be that sort of gist. But the other thing that people fail to understand is also the impacts that testosterone has on behavior and emotional development, regulation, control. People often associate testosterone with this toxic masculinity conversation that it's always going on in the last 5, 10 years. But if you look at data and you look at reports, you look at people who focus on behavior. Dr. Robert Sapolsky wrote a great book on behavior. It's literally called Behavior. There's conversations in that data point that talks about the pro-social aspects that come from highly developed testosterone. Testosterone is looked at as like this negative characteristic that comes with all these toxic traits and behaviors. But when you actually look at what testosterone is capable of facilitating, I think there's also going to be a for lack of better terms, a weaker man in the emotional, psychological, developmental way. Testosterone does have a big key role in pro-social behavior, in pro-social giving, in nurturing in the male sense, providing, giving, doing, all these things that we say men should do more of, but then we're also saying like masculinity and testosterone are bad. But from that testosterone comes the growth of those behaviors, those traits, those characteristics that will make you a better, not only provider, but also a member of society. And that to me is a worrying concern that not only are we, the health consequences, the risk of being less physically active, physically healthy, but then also becomes like, what does that impact on society at large with a declining testosterone rate? It's so much deeper than just your own personal health. It's how does that impact everyone collectively?
Yeah, I think it's so, yeah, it pees me off, to be honest. I mean, the most of the benefits, I think, from TRT or healthy levels of testosterone, a hell of a lot of the benefits are above the neck. It's that psychological aspect to it, which is massively, that's what changes lives.
Yeah.
Even my own personal journey with low testosterone. I had fatigue, which was pretty awful, but largely what TRT did for me was, completely remove and reduce anxiety,
Mm-hmm.
stress resilience, drive, motivation, both psychologically and physical energy. It's kind of like it's so key to how we feel mentally on a day-to-day basis. And so, yeah, it's disconcerting when you think about the fact that we're going to have a lot of low T guys walking around. How it will look will be that we'll probably just be largely less productive.
Mm-hmm.
Um, and, and to be honest, in terms of the masculinity, toxic masculinity, and that sort of thing, I would say you're more likely to be a dick if you have low testosterone.
Yeah. Yeah. Yeah.
You're more likely to be unhelpful. You're
Yeah.
you're more likely to be less, you're more likely to be unsupportive of your partner. It's completely made me a better husband and a better dad. I'm 99% sure of that. I'm more tolerant of the kids playing up. I'm more relaxed. I'm more able to play with my kids. I've got the energy and that sort of thing. I think psychologically it's so key. And it's this kind of misconception of masculinity, isn't it? It's this kind of idea that all masculinity is bad. I love when Dave Lee said something like, "There's no such thing as toxic masculinity. Some people are just dicks."
Yes, yeah.
I thought that's a good way of putting it. Men and women can both be dicks. Like it's just how life is. We don't need to label it with anything to do with being a man, especially. Masculinity is important. It's pretty crucial to how a society runs, and within a household as well. It's not about being like, oh, I'm the boss of my household,
Yeah, yeah,
anything
yeah, yeah.
like it's just being able to function as a functioning partner to your other half, a functioning dad, all about this sort of stuff, really. And yeah, I always think testosterone's biggest game changer is the above the neck changes. It's so huge, so huge. It's underappreciated as well because yeah, we've got the body composition changes, we've got the health benefits, we've got the sexual benefits, but actually what changes lives is the fact that you can think straight again.
Mhm.
You're not riddled with anxiety, you've got motivation, you feel more resilient. Those are all game changers when it comes to your current day-to-day existence, but also your trajectory in life. Yeah.
Yeah, it leads to so many positive aspects. I think you can go down a plethora of benefits on the different pillars that testosterone impacts. You're more active during the day, so because you're more active and more driven, you're achieving more. Because you're achieving more, you feel more confident, more self-aware. Even in the physical exertion sense, you go out and do, and because you are doing, you exert yourself. Because you're exerting yourself, you more align your body with circadian rhythms. So you're actually tired by the time you get to bed or get home. Therefore, you're sleeping more aligned with natural rhythms that we should be sleeping as mammalian species. Therefore, that you're getting active rest because you're resting. Now the body is recovering more efficiently. It's producing the correct hormones in the cyclical fashion that it should. All these things stem from my testosterone is taking care of itself, and then inadvertently we create that positive feedback loop, which is well because I'm taking care of myself, my testosterone is going up. I'm going to continue taking care of myself, and then I'm going to get more testosterone. And so it's like you're upwardly spiraling this positive behavior and these outcomes that you know it's going to make you better and better and better as a person at large. Yet it's like you said, we have this perception that it's toxic and it's negativity because it's masculine. It's like the benefits that come from that, just tweaking those behaviors and it just spirals and it's just an avalanche of benefits that come from it that you could do a 4 hour podcast on and not even scratch the surface of the benefits
Yeah.
that come from it, which
Yeah.
in my opinion would be an absolute walk in the park to kind of dive into. But that is leading to more and more around. Well, I think it's growing, like we sort of touched on in America, the trend of men's wellness, whilst it's not generally acceptable. I think because we are aware, there are coaches like yourself and me that are becoming more and more aware of the benefits, but also that it's needed. The individual assessment is needed. The awareness of the male's problem and experience is needed. Are you seeing in England at least a rise in the trend of men's wellness, men's health? Obviously we've said it's very dominant in America, but are you starting to see at least that shift towards whether it be men's health spaces, men's mental health spaces, men's physical health encouragement? Are you seeing that sort of trend develop over time?
Yeah, I think to be fair, there is inroads that way. I think there's definitely more about it, and I always kind of judge it. It's difficult because I kind of live in a bit of an echo chamber online. I think because I'm always reading about testosterone, exercise, that sort of
Instagram's
thing.
like all of it.
Yeah, I think my Instagram is full of coaches and full of people who do this stuff. So I might live in a bit of an echo chamber, but if if my socials and things are any indication, I think yeah, absolutely. I think there's a lot more people like yourself, like Ali Gilbert, like this sort of cohort of coaches who both don't just deal with, oh, lift this weight, do this. It's kind of
Yeah.
the whole package. I think that's really shedding light on it. The fact that they're able to deal with, like you said, that holistic approach, that's so key. Both in medicine and in, coaching and things. You look at the whole person. But I think the fact that there's more coaches out there who are talking about men's health,
Hmm.
dealing with it on a day-to-day basis, I think that inevitably will filter down through society, spread awareness. Then they'll have other people will pick up the baton and run with it as well. So I definitely think it does seem to be changing. Um, you know, these things take time. You end up being like I'm sure the guys that you know and deal with, that spreads the word locally around their sort of
Yeah.
friendship groups and things like that. So you might end up having pockets of it rather than
Yeah.
just sort of across the nation. But yeah, I think it's definitely shifting. I think that the thing that gets put out there is, like you said, about the suicide rates in young men. I think that just literally shoves it in people's faces. Like,
Hmm.
this isn't right. There's
Yeah.
something not quite right here going on. I think that highlights a lot of it to people. I think it's kind of like, why are our young men so,
Yeah.
depressed? Why are they struggling so much?
Yeah, I think I've got a pretty strong opinion that I used to actually run a men's health group, a private group on Facebook. I think it's like 500 members at one point. We did it out of the fact that those conversations didn't exist. But one of the conversations that kept coming up was if, and it might sound blunt, it might sound direct, but to me, I think it puts it into perspective. If the men's suicide rate was female, there would be a national health service for it, in my opinion. If that was something that if that data, and I don't wish it to be, I'm not saying that's what I want to happen, but if that data point was on the other side of the gender spectrum, then to me there would be a ministry or a cabinet set up to deal with that problem, which to me kind of gives us an indication of how lacking in the awareness at the national level of what men's health actually is and what they're going through, because there is nothing set up individually. This just in Australia, I believe it's 7 out of 11 suicides are male, and and the attempts is almost just as high, just as diversive. There's nothing set up to address that beyond, like we've already spoken about here, beyond just the okay, why did it happen? It's also what are the cofactors that led to that happening. You know, the I think the only good thing that's coming from it is that it's opened up the world to, for a lack of better words, biohacking. But looking at, I guess, a better word would be lifestyle optimization. Probably be a better structured, I guess, synonym of that. And that to me is kind of showing more face nowadays, where we're looking at like get up and go for a walk, get some sun on your skin, drink X amount of water. Can you be in bed by a certain time so your melatonin's higher and you're naturally sleeping more effectively? Did you notice depression come down? Do you find those factors are men coming into you with awareness of that? Is it just that they got no idea, or is it like that biohacking, self development, optimization of health? Is that starting to rear its head a bit more effectively?
Yeah, it's a massively mixed bag of what I see. Some guys come to me and they have no knowledge of much of it at all. They're just busy guys. They have a job. They live a fairly, let's say average lifestyle. Little bit of walking here and there. They walk the dog, but they're not aware of any of the biohacking stuff. I'll have the other extreme where
I
people
know it
are,
all.
yeah, they know
I'm like
loads of
that. I'm
stuff.
like Andrew Huberman.
Yeah, yeah, exactly. They talk about, peptides and, neuroregulators and everything like that. They list everything that they've done in the past. And then there's somewhere people in the middle. I think it's handy when people come to see me and they have at least a baseline knowledge of TRT.
Yeah,
Um, and there's a lot of good information out there nowadays. There's a lot of crap information, but there's a
yeah,
lot of good information as well. So it's a real mixed bag that I see. I I always caution against going too far down the rabbit hole of biohacking because,
yeah,
I think, like you said, if you're jumping ahead of the basis of health, which is the foundations, which is your sleep, your sun, your nutrition, your exercise, people are like kind of taking like five different like types of peptides of,
yeah,
nootropics, all of these things. It's like, yeah, but dude, like you're staying up till 2 a.m. and you're waking up at
yeah.
5.
Your
Like,
circadian rhythm's doing this.
yes, yeah, it's kind of like go back to the basics,
Yeah,
and you probably won't need any of the above. And
yeah,
I'm not against people looking at these things. I just think sometimes it's kind of like, yeah, but how's your diet? How's
yeah.
your sleep? How's your, stress levels? That sort of thing. I think we kind of end up jumping ahead of ourselves, looking, and
Yeah,
it's human nature.
it is.
You want to find a quick fix, like an injection that will sort everything out. It's just you're better served going to the foundation of everything and starting from there.
Yeah, I think the funny enough thing is the basics stay the basics for a reason. It doesn't matter what field you're in the health space. Like even in the training sense, I will always build my programs off my clients from a basic level first. Before complexity, we nail fundamentals, foundations, and basics. For lifestyle factors, for nutrition factors, before I go worrying about what time you have your meals and what supplementation you need to take. What is your total caloric intake? What is your protein diversity? Are you getting optimal fat levels? Because those things matter. Are you fueling training effectively with the right carbohydrates? Those things start to form the basis before we go, what's next? And I think it's the same thing with that level of advanced lifestyle manipulation. Before we go worrying about, your Andrew Huberman 2 hour heat sauna, shock protein exposure, and then a 45-minute contrast exposure session in the ice bath, and you've got, a 4 hour journal meditation first thing in the morning. Are you getting 7 to 9 hours sleep? Are you having X amount of fruit and vegetables a day? Do you have the right balance of protein from multiple different sources? Do you get essential fatty acids into your diet? Do you get fish oils into your diet? Do you have a good intake of dietary fats? Are you physically exerting yourself across the day? Do you have a partner? Are you intimate regularly? Do you have goals in life? Build that pillar out first, and then we'll worry about some more stuff. Because with that, I can get more specific. I can make specificity, especially the level of bodybuilding coaching when nuances on how you look on the day matters drastically. Those things start to play up. But to me, before I even get to the level of just talking about introducing exogenous supplementation, the amount of times I've actually talked more people off competing and taking supplementation in the sense of talking about our supplementation. Most of the time, I'm looking at before you even touch that, because let's be honest, people are going to do it. Before you even touch that, can I at least make sure you're healthy first? Do you have a diversity of nutrient intake, micronutrient intake, antioxidation? Do you have the right nutrient, the diversity to avoid deficiencies? Can we supplement what's missing? Those things start to matter before we go, hey, before you go sticking things in your body that are carcinogenic or at least oxidative, can we look at what you're doing to be proactive, preventative? What are you doing to maximize the natural tools at your ability, at your what's the word, available at your disposal? Because, like you said previously, before we go introducing these unique, nuanced minutiae, you're probably not going to get much from it if you aren't doing the majority of the basics. And
Yeah.
I find the same response when I've seen people's blood work, I've seen people's supplementation. They've come from other coaches to me, and their stack is this high of drugs, but their lifestyle modifications, skewed out here doing God knows what. They're like, yeah,
Yeah.
my coach gave me more, stanozol or D-bol or Decker, and I'm like, cool. How do you feel? Inflamed. My skin looks like shit. My body looks like about to explode from blood pressure. My resting heart rate's through the roof, and all these things. I'm like, so you've gone to the extreme before we've gone to the basics.
Yeah, yeah. I mean, I work for another a clinic on some days of the week as well, which I really enjoy the work of. So it's a private bloods and investigation company, but they also see a lot of bodybuilders. They've got a lot of
Oh, amazing.
clients, coaches who bring their bodybuilders for bloods, and it's for the general public as well. But that's enjoyable work because, but exactly like you said, you can tell the difference between the coaches because some of these guys will come in and they'll list their medical, their extras are down, and they're on like 12 different agents, and you'll be
Yeah,
like I can't advise you on your cycles and things like that, but your
yeah,
bloods look really bad. But it's kind of like you've got like everything has gone wrong here.
yeah,
Which is, like you said about before, it's if you are doing that stuff, it's key to get blood work before, during, and after, I think, as well. But yeah, it's interesting to see the different approaches of coaches, and there is that thing where it's kind of like you can't just keep adding more
yeah,
stuff,
yeah. Here's the kitchen sink.
yes, yeah, yeah. I had one guy who was on 14 different things, and I was like,
Oh, that's ridiculous.
he was like, I don't feel great, and I was like, I'm not surprised. Like,
Oh
Jesus.
shit.
Yeah, yeah. So that's enjoyable. It's like when it's like T3, T4, insulin, three types of insulin, like, a couple of DHT derivatives, including an oral and tren and It's just like,
I'm
let's calm down here.
running four different 19 Norse, but I can't understand why my brain's not functioning properly.
Yes, yeah, and my dick won't go hard, and it's like I think I can help here.
Yeah, that's it. Yeah, yeah. I mean, like I said, we could run a 4 hour podcast on just that topic alone, which is unfortunate. There isn't more of them, but it's stuff that we endeavor to put out and try and help on for those reasons.
Yeah.
But I'll be here all day with you and take up all of your time. I've got so many questions, but I love these conversations. It's been a great conversation. One of my final questions is in the space of men's health research, men's health data, men's health trends. Is there anything exciting in the TRT space you see coming out that is looking to make a drastic difference, a significant impact? Is there better esters that are coming out? Are we looking at different modulators? Are we looking at, I think a big one to me is understanding that AIs aren't always necessary. I think the research on that's becoming really beneficial. I see too many clinicians just kind of go, here's test, here's an AI, and we're going to completely block and shut down your estrogen. It's like, let's not do that. That's just my personal take on what I see in the data anyway. But yeah, what are you seeing as something coming out that you're kind of like, fuck, I can't wait for this to get out?
Um, nothing drastic like change of like modality of treatment and things. I think that awareness of the estrogen thing is becoming more and more prominent, which I think is so key. I mean, I don't like, I'm kind of in the silverback club, so I don't really prescribe AIs.
Good, yeah,
When it comes to TRT, I just think it's a misunderstanding of how the
yeah,
whole process of the conversion of T go into estrogen actually happens. It's a misunderstanding of the role of estrogen in
yeah,
men. It's a misunderstanding of that reference range you get from the labs means diddly squat when you're on an
yeah,
exogenous hormone.
yeah,
So I think that's becoming more and more um, out there. I think more and more practitioners are aware of the fact that, hold on a minute, the lab level of estrogen doesn't really tell us anything when it comes to TRT. That's
yeah,
kind of like that information is getting out there, which is great because I think people are going to get better health outcomes from TRT if they're not
yeah.
blocking estrogen. The majority of your benefits of TRT, a large percentage of it comes from the estrogen conversion.
Mm-hmm.
That's a big thing. I think people are becoming more aware of this concept of microdosing rather
Yeah.
than,
So
like
we want
even
to
like
expect smaller exposures.
exactly. So, I think, a lot of us think now that probably a nice sweet spot is like 3 injections a week if you are injecting. Two for some. Some even do like a microdose daily of, like
Yeah,
a small dose of tea. I think that's getting out there, and I think that's really key again to symptom response, but probably outcomes long term as well. I have like I always say to new patients when we're talking about the injections and things, it's kind of like occasionally guys will get away with once, I do have a few guys who do once a week injecting and they're fine and they feel
yeah,
great. So it's like, it's working for you. But most will inject more frequently than that. But it seems like there's kind of like a sweet spot of kind of like lack of hassle and ball ache
yeah,
with daily 3 times a week seems like a good regime to go with. Um, I suppose people are looking at again at there's one called Chirotrex, which is an oral testosterone form. I'm still not on that boat, but that seems
yeah,
to be picking up a little bit of traction. Um, but yeah, we still stick with the basic esters, testosterone, cypionate, and enanthate.
yeah,
Split your weekly dose up. Cypionate in the UK is my favorite option because it comes in those nice little 10 ml multi-dose vials. So it's
yeah,
just a less of an arse of transferring ampules
yeah,
into vials and things like that.
yeah.
So yeah,
In Australia, clinically, you got access to like stanozol, testosterone, anthate, cybermate, but then you also get the access to primobolan. But primobolan tends to come in 1 ml like single shot dose vials. So you might get a 10 ml, clinical prescription, but you then got to lug around, 10 mils with you everywhere you go if you need to do
yeah,
needles or travel or go do things. So it becomes such a you go straight from what is looking like a single use limitation to are you trafficking? Are you shuttling? Like, what are you doing carrying 10 mils
yeah.
around? Yeah, it's 10
Yeah.
individual mills. It's not 10 vials, it's 10 individual mills. But yeah, I've seen that, as well. It's like that Primobolan over here is sold or given as prescription as, single use doses to control risk management. But it just becomes so frustrating and annoying for a lot of people. But yeah, I mean, yeah, I am glad more people are seeing the estrogen conversation again psychoactively. It's so important. People fail to understand it's neuroprotective and again, almost that emotional regulation synergistically with testosterone. That's just not part of the conversation. And it's like there's so many coaches that will just throw everything in the kitchen sink and go, but also we're going to pull down your estrogen. Like actually, you kind of want to see it raise, at
Yeah.
relatively associated levels with your test. So that I think is a great approach that more people should have. It kind of ties into another question. I'm going to throw a few rapid fires at you. Um, if we were to get blood work done, what are the five things that you would look at on the blood panel? Is like I guess a primary. Those are big markers to consider.
Oh, lovely question. Yeah. I like sort of HbA1c or fasting insulin.
Yep.
I really think, getting a baseline idea or look at your level of insulin resistance sensitivity. I actually quite like triglycerides, almost over lipid panels if you're just limiting me to five, because I think
Yep.
triglycerides give you an indication of your metabolic health,
Yep.
maybe give you an indication of how much fat you're carrying inside, which
Yep.
is key. Um, what else? Maybe if we're doing five, I'd say put your sex hormones in there. So testosterone. Mm, I don't know really. We're limited here. Thyroid and some
Yep.
sort of organ function. Some
Yep.
sort of whether it
Yep.
be kidneys, liver. Depends on what you're doing and how you're feeling and what your lifestyle's like, I suppose. But
Yep.
I do like triglycerides. I like checking your insulin resistance sort of
Mhm.
picture and then your hormones really.
There's
But
just
you could argue for loads of different tests. Yeah.
this is just a random question because it just brought on a thought in my head. How do you guys find in just the NHS system, like if you were to go to a doctor, so I have to have my clients be very specific. If they do have a doctor that will do tests, I have to have them ask for a full, complete sex hormone profile. Because if I say, hey, I want you to just go get your bloods done, it'll be either a total test or a free test, not even both. And it won't be, estradiol, it won't be progesterone, definitely not pregnenolone. We're not getting any other sort of like steroidal type hormone assessments. It is literally just going to be an individual metric, and then it'll come back and be like, "Oh, your test is in a normal range." Like, what's a normal range? What's the relative association? What's everything else
Yeah.
related to it? What's it in contrast to my estrogen levels? Like, I don't know. Is that the same in like the NHS? You guys over there? Is it? Is it?
Yeah, yeah. It's predominantly just a total testosterone that will be checked if it's done. No SHBG, no free T,
Yep.
no gonadotrophin, so the signals from the brain to the
Yep.
balls. You don't know what your LH and FSH is. And then the patient will say, "Yeah, I was told it was normal." I was like, that I want the number
Yeah.
because
Yeah.
what is normal?
Yeah.
Define normal for me. What they consider normal may be very widely off what I consider to be normal. So yeah, there's there is that yeah, definitely that issue. Just for people listening, get both. You need to know your total and your free T.
Yeah.
Really good idea to get an idea of your LH and FSH, which is those signals, because if you do have a testosterone problem, you kind of want to find out if it's your
Yeah.
balls are failing or whether it's,
Yeah.
something else.
Yeah. No, I completely agree. Again, on a podcast topic just on sex hormone functions. Um,
Yeah.
another question here: if you were to pick at say five factors that you would look at lifestyle wise, whether it be sun exposure, vitamin D, whether it be vitamin D deficiency, whether it be more physical activity in the mornings, regulating your circadian rhythm, what would probably be five factors or like life optimizations you would suggest to really help impact testosterone or sex profiles?
Yeah, yeah. Number one would be sleep.
Yeah.
I think it's such a key one. I mean, if you don't get a good amount of sleep on a regular basis, it's going to impact your sex hormones. Um, yeah, sleep, definitely regular physical exercise, partly because it's going to help your sleep as well, obviously. But we want to, look at reducing insulin resistance, inflammation,
Mm.
which is key to promoting sex hormone production. So regular exercise. probably much like, I don't know if this is what you go down the route of, but I like a mix of obviously cardio, at least some steady state cardio, but resistance training as well. You're basically often with these guys, and then you'd probably be so sleep, exercise, nutrition, but usually for most blokes out there in this day and age, it's about getting to a healthy body fat level.
Yeah,
It's if there's one way of reducing your testosterone levels other than sleep, it's being fat, basically. It's
yeah,
being overweight, So if you can get your body fat percentage at least below 20%,
yeah,
probably ideally around 15%, maybe between 10 and 15. There's
yeah.
um, different guys will maybe have different set points, but 10 and 15% seems pretty good for hormones. And what else would I think? Probably booze. I don't know what
Yeah.
it's like in Australia,
Oh yeah.
but the amount of guys who regularly have like one, two, three beers a night, or
Yeah.
they're hitting it hard on the weekends,
Yeah.
um, that just dysregulates so much stuff
Yeah.
that,
Yeah.
that would be, I think that's going to have a positive knock-on effect. A big deal, and I know this isn't a quick answer, but regular alcohol. People ask me about their cholesterol results, and obviously cholesterol is such a online, you know, hot topic. People like sort of
Never got
like
bad anymore. HDL's horrible. LDL's good. Leave
yeah,
it alone.
yeah. It's like either it's the devil or like who cares? It's kind of like, somewhere in the middle. Regular alcohol is what I see regularly skew lipids, like,
Yeah.
really not pretty. But actually abstinence or at least a big reduction really improves your LDL, HDL and all of that sort of stuff. But that's just for people listening. So I would say booze. And then fifth, what would I say? Probably more of a psychological thing in terms of lifestyle. So meditation,
Yeah.
purpose, that sort of thing, having
Yeah.
healthy relationships, reconnecting with your other half, all of those things, having open communication with your partner. Because obviously when people have low testosterone or not great levels, there can be some sexual issues there.
Yeah.
But I was talking to a buddy of mine, Dr. Jordan Grant at Silverback, and I was like, it's so key communication. Like it just
Yeah.
removes so
Yeah.
much of that stress. If you're like, it might not work, but let's have a laugh about it.
Yeah.
Let's just relax and
Yeah.
just get into it. That can be a game changer to people's lives. Yeah.
Yeah. Yeah. I mean, just on the topic alone, the sheer stigma around erectile dysfunction, but people not understanding why it's happening. Like, it is a personal experience for me. I had a partner who once made it about her, and not to even get into anything about her, but at the time my father had passed away, and it was like the next day. And basically, at the time, that was like her way of trying to console me. It was like, we're gonna do it, and it obviously wasn't in a position where that's what was functional.
Yeah.
And it was like, oh, you must not find me attractive. And I'm like, that's just my experience. What are other men facing when that happens? And I'm like, that was such a unique, what's the word, experience. I'm like, I've gone through this traumatic thing, but it was like, instead of having the conversation, like, hey, understandably, your father just passed away, this happened, and obviously things aren't working. It was, this lack of communication around, oh, but it must be because you don't find me X. I was like, no, 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 that's just it's that significant traumatic thing just happened. My brain's not
Yeah.
going there.
Yeah.
But there's
Yeah.
just it's such an absence of experience and conversation because men just get ridiculed for it. It's such a mockery of like, your business doesn't work. It's like, well, what are the multivariant reasons why it's not working? That in of itself is a 4-hour podcast of conversation around what could be leading to physiological stress, psychological, emotional, hormonal dysregulation, yada yada. So just that I think is a fantastic point. Is like if you're as a partner, you have a long-term relationship and it's not working, or it may not work, or you are experiencing that health concern until you get it dealt with. Hey, this is probably going to happen. It's not you. It's me. But here's why. Just take
Yeah.
so much stress around from the situation.
Yeah. And make a laugh of it. Just be like,
Yeah.
oh, he's not
Yeah.
working today. Never
Yeah.
mind.
Sorry.
We'll do. Yeah.
Taking
We'll
the
do.
day off. Yeah. There's no one
Yeah.
sick today. Sorry.
Yeah. We'll do other things.
Guys left his post. He's not standing attention.
Yeah, yeah. It's just I think in a sense I kind of like to take life not too seriously, and I think probably my experience with low testosterone, how rubbish I felt every
Yeah.
day, has made me see light in sort of the day to day existence of things that we kind of really get worked up over. But if you just have a laugh about a lot of
Yeah.
these things and just take it a bit lightly, it can actually be helpful. Yeah.
Final question, mate. What is one key myth that you wish would be removed from the stigma of getting TRT?
I think just a bloody acceptance that it's a hormonal deficiency that has
Yeah.
bad outcomes. I mean, it just seems so crazy to me and so strange that people, even like medical people, will talk about TRT and testosterone, and it's kind of like it's removed from all the other types of deficiencies that we talk
Yeah.
about. So it's kind of like, yeah, it's weird, isn't it? We've got all these studies now that show that low testosterone leads to bad health outcomes. It's like, that's a surprise. You're deficient in a hormone.
Yeah.
Isn't that weird? It's like we had to have research to say that low testosterone was a bad idea. It's like, why is it treated any differently to low thyroid? Why is it
Yeah.
treated any differently to a lack of cortisol, which is a bad condition? Why is it treated differently to low iron? All of
Yeah.
these things where we see a deficiency and we say, "Oh, that's not good. We should
Yeah.
do something to correct it." Whereas testosterone, I presume, I don't know, I think it's because of the bodybuilding association.
I think
It's
it is.
kind
Yeah.
of it must be. I can't explain it otherwise. It's taken out of the rest of the field of medical deficiencies and
Yeah.
it's put in this other box where it's either ignored or poo-pooed. And
Yeah.
it's like, this really doesn't make sense. And then you see the life-changing effects that it can have, and you
Yeah.
think, my God, it needs to go back in with the rest of the
Yeah.
group.
Yeah.
So
To
it's
me,
very strange to me.
the rhetoric is almost like I've seen Ali share it a lot, where it's like, oh, it's cheating. And I sit there and look at it and I'm like, let's say we've ticked all the boxes of like lifestyle mitigation, optimization, we've done everything right. And then it's like it's still not functioning. And I'll see women, males and females, but I'll see women or I'll see other men be like, oh, it's cheating, you're selling yourself short. That could be your dad, brother, uncle, nephew, son that is on the verge of suicide, depression, taking care of themselves in a very, bad way. The consequence of that low testosterone, you're going, it's cheating. Like, if you had depression, I meant to give you a medication. Is that cheating psychologically? If you have an
Yeah.
underactive thyroid and we give you T3 or we give you T4, and all of a sudden your thyroid's functioning again. Now you're active, your metabolism is at a higher rate, you're churning more calories, you're losing weight again. Is that cheating? Like, my father had cancer. If they're giving him radiology, is that cheating the cancer? Like, it doesn't make sense to me where that conversation leads to cheating. Like, firstly, I think most people will be surprised at how many people in professional sports use exogenous supplementation. I think they have a really skewed perception of what actually goes on in elite sport. But outside of that conversation, it's general life. You're not competing with the person next to you about who's got the better test levels. If it's going to keep you alive and functioning until you're 70, 80, 90, fucking go get your TRT, please. Get it done. We have menopausal treatments for women, we have postmenopausal treatments for women, but it comes to the idea of testosterone. It's like just age gracefully and you should just wither away. And, here's a really interesting number to think about for people listening. The average age of menopause is 40 to, it declines at 30. The average age is 45 to 55. The peak midlife crisis and psychological depression rate for men peaks around 50 to 60. So there is a correlative crossover there in the relationship between midlife, suicide attempts, depression, anxiety, male, just life is mixed up. And when we have our lowest levels of tests, but the average age of a male is 75 to 85. So there's still another 20 years on average that we're living, maybe even 30 years, with low testosterone and andropause, but there is this weird perception that it's cheating. I just don't grasp how that makes logical sense in people's heads. That we're literally encouraging the absence of health because cheating.
Yeah, yeah. I think Ali gets a lot of that online about how it's kind of like, oh yeah, your guys are just on TRT, so they're cheating, which obviously not all of her clients are on TRT for number one. But number two, it does benefit you body composition wise, even compared to sort of healthy, fairly healthy natural levels. But
Mhm.
that's not why we're taking
Yeah,
it.
yeah, it's a byproduct.
It's like it's a nice pleasant side effect, let's say. It's one of the good side effects that you do have some body comp benefits. Um, yeah, I mean, if someone came to me and said, my body composition isn't what I want. Can I have
Give me
TRT?
testosterone.
Yeah, I was like, dude, it's not worth being on a lifelong treatment, potentially lifelong treatment for the slight body composition changes it gives you. Like that is not why these people are going on testosterone
But
in the
the
form
funny part
of
is, though,
TRT.
as a byproduct, who knew that if you improve vegetable consumption, fruit consumption, protein intake, exercise, better sleep and output, that your body fat will drop down? Like, is that
Yeah,
like, holy shit, who knew?
yeah, yeah. It's the new science.
Anyway, mate, we're going to be here all day. We could be all night for me, all day for you, and I don't want to take up any more of your time. Absolute pleasure talking, and hopefully, we've sparked some interest for people to go be more aware of men's health, go be more aware of TRT, do some more research on it. I'd love to keep having more of these conversations with you guys. I'm thinking about trying to drum up like a round table between me, you, Ali, and Dave. I think that'd be a fantastic conversation. That would just be spiraling in all sorts of directions. Where do people find you? How can we direct them to you? What can we do to push your stuff out there? Name drop it all, and we'll have it all in the links below.
Yeah, so probably sort of Instagram. People can sort of DM me if they're not sure about, questions, queries, and things. That's at Dr. underscore Max underscore Draper. It used to be Max Your Tea, but I changed it to be more professional. It was a really cool name. My
That's
wife came
good.
up with it. Yeah, yeah. But then I realized it sounded a bit too kind of like unprofessional. It's like, yeah, Max Your Tea. And I thought, yeah, maybe we should change it now.
It's like
Or
those high
at
school email addresses you have that you're now embarrassed of.
Yeah, yeah, yeah. It's one of those really. I had sort of so Instagram. I'm on LinkedIn, Dr. Max Draper. But the main one is alphagenix.co.uk as well for the website. That has my details and links on there. And there's obviously, like I said about that other blood sampling clinic, is Atlas Laboratories. They're ace for people who are being coached by people in the UK. Holly, who runs it, is really, really knowledgeable of this field.
Good.
So she's really good for those coaches and bodybuilders out there. I definitely recommend that.
Yeah, I'm really enjoying seeing, between not that, it's for bodybuilding, but for that particular branch, I guess, seeing Marek Health, seeing Atlas, seeing
Yeah,
Primal Zone, these companies starting to take it seriously. Like, the people are going to do these things anyway. Should we not be risk averse or risk aware, or at least health conscious of it? Just because people are going to take every elite athlete ever is willing to risk their health to get the outcome. Doesn't mean we should just ignore it and let it go. It
yeah,
to me should still be a conscious effort to help them be healthier and make the best choices. It's like saying we shouldn't put out alcohol knowledge because people are going to drink and it's a toxin. People are going to drink regardless. We should at least make them aware and healthy as much as possible to offset the alcohol. So I think it's fantastic to see that growing in the UK as well. UK is a massive field for bodybuilding. The Mr. Olympia trophy just went back there this year. Samson won, Mr. Olympia, so it's back on English shores for the first time since Dorian Yates. So that's big for British bodybuilding. But mate, like I said, absolute pleasure. I've taken nearly 2 hours of your time. Thank you for all your knowledge and information, and no doubt we'll be chatting again soon.
pleasure. Thank you very much for having me.
And yeah, we'll stay in touch. Cheers, mate.
Cheers.